Hello medicos. Now we'll discuss about the radial nerve, which arises from the posterior cord of the brachial plexus like axillary nerve and arises from the roots like C5, C6, C7, C8 and the T1. Okay, axillary nerve is from only C5 and the C6. Okay, so see these directions: superior, inferior, this side is lateral and this is medial. Okay, so in the axilla, this radial nerve give one branch to the posterior cutaneous nerve of the arm, then another branch is to the long head of the tricep, then it comes in the axilla and it will be lateral to this profunda brachii artery. Okay, so it will be lateral to this profunda brachii artery, and here it will give one branch to the medial head of the triceps. Okay, then it continues and it will give one branch to the lateral head of the triceps. So till now we have seen all three heads of the triceps is supplied by the radial nerve. All three, that is lateral head, long head and the medial head. Then again it continues in the arm and will become the lateral cutaneous nerve of the arm. It will supply to the anconeus muscle, then it will give one branch to the brachialis muscle, which is the small on the lateral part. Another branch is the brachioradialis muscle. Another branch is to the extensor carpi radialis longus, and another articular branch is to the elbow joint. Okay, so elbow joint, this is the articular branch. These other all are the muscular branches. Okay, then again it continues. Okay, so it is continuing as the posterior cutaneous branch of the forearm. Okay, now in the now again it will divide into the two branches, that is the one is the superficial branch, one is the deep branch. For the deep branch there is another name which is called as the posterior interosseous. Okay, so posterior interosseous nerve, we call this to the deep terminal branch of the radial nerve. Okay, so first let's see the superficial terminal branch. So this superficial terminal branch will lie, so this side was lateral, right? So this lies medial to this radial artery. Then this superficial branch passes medial to this radial artery and passes beneath. Okay, passes beneath the tendon of the brachioradialis, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and continue as the cutaneous nerve of the forearm. Okay, cutaneous nerve of the forearm. So this is the course of the superficial terminal branch of the radial nerve. Now let's see about the deep terminal branch, which is nothing but our posterior interosseous nerve. Okay, then it will give branch to the supinator muscle. Okay, it will give branch to the supinator muscle. In the forearm, it will supply to the extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and the extensor intermedius. Extensor indicis. Okay, sorry for this. Then it will give two articular branches to the inferior radio-ulnar joint and one to the wrist joint. Okay, so here are, like, I understand here so many muscles to understand, but like we can write, see, radial nerve is for the extensor compartment, ulnar nerve is for the flexor compartment. So all the extensors muscle, like we know extensor carpi radialis brevis, extensor carpi radialis longus, all we can write it over here. Okay, so you can remember it like this.